Welcome to the Sense of Hope podcast by One Life. I'm your host, Helen Diveston, and today we have Sonya English. Sonya is a registered nurse and a PREKURE Master Holistic Health Coach. She is also a trained transformative life coach and is an ICF, ACC, and critical care patient at risk nurse specialist and holds a Master's in Health Practice. Her vast experience affords a holistic approach to champion her clients' wellness. As a health coach, she believes that working with her clients' vision and values to support their movement from where they are now to their desired goal is paramount. Her focus is on clients' strengths, their life world, and their untapped awareness to move forward positively and sustainably. Sonya is a passionate advocate for the proactive prevention of disease and living the best quality of life we can. Welcome to the Sense of Hope podcast, Sonya.
Thank you, Helen. Nice to see you.
So, Sonya, the first question I have for you today is, what got you into nursing in the first place?
Oh, good starting question. Thank you, Helen. So that's going quite a few years back, over 35 years back. And interestingly, I had a brother who was very sick. He had child leukemia, acute leukemia, and he was around about 10. And that was in the days in Auckland of the old Princess Mary Hospital. And so in those days, children didn't survive. And so it was a big shock to our family. And he tried some new treatment. There was three children in New Zealand that tried it. And so he spent probably the majority of 3 years in and out of hospital of Princess Mary. So I was a couple of years old. I spent a lot of time in hospital, as you can imagine. And as part of that, I sort of spent a lot of time with nurses and saw how they worked. And there was some really good ones. There was also some grumpy ones. And a few times, I looked and thought, if I did that, I wouldn't be like that. And so I guess that's where my passion for nursing started. When I say that, because I'm still very passionate about nursing. And caring for people came from that experience. And my brother did really well with that experimental treatment and is still going well and happy today.
Wow, that's incredible.
Yeah, it's a lovely story. Yeah.
That is a lovely story. Wow. And I think for many people, we choose our careers and it's often driven by personal experience.
Yeah, that lived experience. And I think kind of it informed a lot of my thinking in a very early age.
So I understand that obviously you became a nurse and then you ended up working in critical care ICU. I'm curious to know, how was that progression to ICU nursing?
Yeah. So I actually started off trained in the 80s and ended up at the time when I graduated, nurses were not getting in jobs in New Zealand. So I ended up over in Australia working in surgical, and from there went into intensive care and then at Green Lane back in New Zealand. And I think all of my career, I've really worked in acute care, intensive care, in many different roles. And what I loved about that is I'm a bit of a science geek. I love physiology, science, neurobiology, and understanding how things work. And so being an intensive care nurse, I'm standing at the bedside and watching it in motion, seeing shocks, seeing all of those things and be able to tweak things and support the organ failure in my clients and my patients. So it was out of that interest, and just, I guess I can continue to love being able to use latest science and evidence to make a difference in health in terms of that acute phase. I became a senior nurse in ICU, an educator in intensive care for many years, worked over in London, overseas, and neurosurgical ICU, general ICU, cardiac ICU, and then became a flight nurse specialising for Pacific ambulance in New Zealand, Pacific Air Ambulance and Westpac, doing critical care nursing as well. So I've had an amazing, very lucky ICU career. It's been fabulous.
It sounds absolutely amazing, and what a wealth of experience.
Yeah, well, just I think fortunate being in the right place at the right time. And
Yeah.
just I've made many friendships and met some pretty incredible people over that journey.
Mm, mm. I know that you've trained to be a health coach. Now, this just seems like such a step in a different direction. So, what made you choose to go from ICU nursing? And I know you still do a little bit of ICU nursing, but what made you
Mhm.
train to be a health coach?
So I think I had this kind of bird's eye view from when I started in the 80s in intensive care medicine, and now I've seen the age of the clients and people I serve get younger and younger with multi-organ failure. And that's that anecdotal view. And I think I've watched that with horror. I've watched the amount of preventable, non-communicable disease just rise. And we see this in the statistics. Our insulin resistance, our mental health, everything is on the rise. What I know is that it's preventable. And I guess I had a few, and we all have this as health professionals, kind of pertinent moments, if you like, with particular clients and patients. And one in particular that I remember was a young girl who only in her 20s, who had been in the intensive care for many months. And her, her acute episode was from an underlying chronic preventable disease. And she arrested, and we couldn't, we couldn't get her back, for want of a better word. And, having to talk to parents, having to live that as a nurse and realize that actually this didn't have to be. I think that was one of the triggers of actually, I need to do something. I'm watching this. I need to do something. The other thing that probably really got me into health coaching is having a conversation with Professor Grant Schofield from PREKURE and his wife, Dr. Louise Schofield, who were very much into fitness as medicine and, functional medicine. And I'd often talk to Grant about, I really get frustrated with the lack of client and patient voice at the end of life. I feel like we are doing a lot of therapies and things to patients, which I don't think they fully understand. And I don't think they've had a chance to voice what it is they really want. What is it they want for the end of life? Do they really understand these treatments? Do they want to die in a hospital attached to a lot of machines? And
Mm.
so this, over those years, was some of the things, the ethical challenges that I was dealing with. And I became a practitioner in advanced care planning within my role with deteriorating patients. And we're having those conversations right at the acute moment, which is really tough. And I was quite passionate about having those conversations early and actually understanding more about what is it people really want, what really matters to them.
Mm. So by the sounds of things, you've managed to bring that coaching role into the ICU in some ways.
I have. I have. And I have to tell you, Helen, that when I first started health coaching and understanding the kind of transformative approach, which I think is incredible, is that I thought I was a good communicator as a nurse. And nurses are. They spend a lot of time at the front line with patients in whānau and really seeing patterns and trends and getting to know things.
Mm.
There's so much super skill in nurses. I'm a great advocate. But I think health coaching was one step further. That was actually seeing the person, not the problem.
Mm.
So for me, it was almost the missing piece of the puzzle in the way I practice. And so now when I'm in the deteriorating patient, the ICU environment, I'm still a new specialist on a casual basis. My coaching has changed the way that I work. I will always ask, what one kind of open-ended, really reflective question to the patient, even if I've only got 5 minutes, to try and help me understand what are their values in this situation, what's important to them. Before I was fixing, I was just doing too.
Yeah, I think that's a role we've given ourselves as nurses. It is to fix, in the medical profession, actually, completely. You fix people, you make them better, sometimes even against their will, as you say, that they may not actually want the treatment. If they really understood it, they may not actually want it. But that's our job. We go ahead and we do it. We do the right thing by us. And you're right. We often don't actually stop and go, well, actually, what do they really want? Or what does their family really want in this situation? So
Yeah.
that's so interesting that you've actually been able to bring, and it's empowerment, isn't it? It's an empowering the patient or the client in that health care, in that health crisis.
Nothing like seeing a patient and whānau recognizing they have some power.
Mm.
You see the sort of shoulders go up and the light bulb go on. And I think, what I've learned through this work is that sickness is a terrible hindrance. It's tough. A lot of the general public don't see what goes on. However, no matter what happens to us in life, we still have choice. And for me, it's giving people back the choice, giving them back the ownership of their own health and actually the intuition of their own body.
Mm.
That's something that our modern healthcare system has often kind of missed.
Mm. I just want to tell a little story of a young man that I saw after being in psychiatry for many years and then leaving psychiatry and training to be a life coach, working in a holistic health model, and then going back into psychiatry, into mainstream psychiatry again. I was asked to see a young male who had a non-healing wound, had had many surgeries, and the team had asked us to come and see him because they thought he might be depressed. I first looked at his bloods. Of course, his hemoglobin was low. So I was like, well, of course, he's going to be feeling tired and miserable. But when I went in there, he was this passive recipient lying on the bed, and we really talked about where he wanted to be, what his future held, why he wanted to get out of hospital, what was important to him, and it was rugby, and he had a family, and so we talked about all that. I focused a little bit on his diet and nutrition because it was KFC and Fanta and, because he didn't like the hospital food. We had a wee chat about that. So I really talked to him about what he could do as part of his recovery, which was actually eating really good food, getting as much nutrition as he could, doing the exercises that he wasn't really motivated to do. I came back 2 days later and he just looked completely different. He was brighter. He had homemade food brought in, which was much more nutritious than probably even the hospital food, to be honest. And it was just so lovely to see that, I have some power. I have some agency in actually how I recover from this. It's a wonderful thing to see.
Yeah, one of my favorite things to say to nurses when I'm teaching nurses health coaching is, when your client, your patient has investment in the problem, an agency of the problem, they're more likely to be involved in the solution.
Mm. Yeah.
And so, giving them that power really creates that inner motivation, doesn't it?
Totally, completely changes their interaction, actually. It sounds like coaching in some ways would be great for almost all nurses
Definitely.
to be trained in. Yeah.
Definitely. I would fully advocate that. I think being able to see the person and not the problem. And also, being able to use the metabolic medicine, the tools in health coaching. There's a lot of research going on now. There's some incredible tools out there to be able to share these simple things that you can do in the acute phase and the prevention phase. I think of so many scenarios, preoperative. There's a lot of surgery going on out there. There's a lot of insulin resistance, chronic health is like this. Getting people prepared to do better, being able to, when that family member, whānau, comes to you and say, what can I do? Having some small tools, prioritizing sleep. Sleep's at the very top. Without that, all else fails. It's very hard to eat well, to connect with people, to move. Movement is definitely medicine. When we move, we actually secrete growth factors that actually clean out our cells, that create better brain function, heal. So all those little things are so important to teach clients, but also ask them, what do they already know? What does health mean to you? What is one step you could take? And actually celebrate and champion the knowledge they already have, rather than always telling and fixing.
Yeah, which has been our traditional role, hasn't it?
Yes.
You should move more, and you should eat better, and whatever else we might give, the instructions that we give as part of nursing or medical care. Yeah. So you work now casual in ICU, but then you work as a health coach.
Yes.
Yeah.
So I contract to a few different people. One of the jobs that I have is I contract to PREKURE as one of the lead health coach trainers or faculty. So I work with communities of people that are coming in to learn to be health coaches in New Zealand and Australia, and actually now worldwide. Now, this is an absolute privilege, this work, because the community choose to come and do this training. There's a lot of healthcare professionals, all different walks of life. But they are really keen to see a change, a more meaningful way of doing health for their whānau, for their communities, for themselves. A lot of them come with lived experience of health. And it's an absolute joy to watch them take on this science, to be able to understand how the theory of transformational health coaching and how listening to others to hear rather than to tell, the power of that, it's really a privilege. I love that work. I also have my own business, Sonya English Health Coaching. So I have my own clients. As a health coach, I'm particularly interested in mental fitness and nutrition, metabolic health in terms of that, and all of those other levers that I talked about before, the sleep, the nutrition, the movement, the breathing. If you watch a lot of people now, they're walking around with their shoulders up, kind of hyperventilating, not breathing properly. Their cortisol levels are out the door. They're getting the dopamine hits. If you really
absolutely.
think about it, we have Paleolithic brains, right? We are wired for survival. We are wired for dopamine. So that's really not serving us. We're eating so much ultra-processed food. We are Ubering anything. We're Netflixing. We're hardly moving. And we're hyper-connected. And it's a volatile environment to try and be healthy in.
Yeah.
So for me, doing this work with my clients, teaching health coaches is a pleasure.
That's fantastic. This is a little bit of a throw in the ring question. Can you give us an example of maybe a typical client that might come and see you privately?
Yeah, so it might be someone who's come in who's feeling overwhelmed and stressed. And I do work a lot with health professionals. So a lot of my work goes to help it. And so they're wanting to actually get out of the overwhelm. They're talking about wanting to change their healthy habits. They know that a lot of their habits is, focusing fully on work, trying to get more done with less, and that they neglect their family, their whānau, they're neglecting the things that give them joy. And so we work together to kind of dive a little bit deeper on what really matters to them. What are their values, their beliefs? What do they already know? And what is the outcome they want? And that journey with them. What I love about health coaching is they're very much leading the process. They're the expert in this process. I'm sitting in the kind of the back of the bus going, getting quite curious. And so I will kind of explore alongside them all of the things that are important, and then with permission, add in the science where they need it as it meets with their goal. I use some very health habit and behavior change tools that, when I say great, they're incredible, to kind of understand where they're at as well and help them understand, why it's so hard to change the habit, and get a little bit of understanding about themselves. I think health coaching is about people learning about what really matters to them, but having more self-awareness. And what are their limiting beliefs? What gets in the way? They often know a lot of what they should do.
It's one thing I often say is that the health professional is the expert perhaps in the science and in their field, but the individual is the expert in themselves. And we don't give that enough credit when we're face to face with someone.
It's actually so shocking, Helen. Even just going into the hospital and asking one question, what do you already know? How much people do know. And I think, the mindset of a health coach is that my client, my patient, is whole, real, and creative. And shifting your mindset to the way that you're seeing the people you're working alongside, and actually moving in a way that looks at their strengths, that asks things like, where else are you confident in your life? And how could you use that to see this, look at this problem, giving them the tools to actually be able to navigate and project manage also their own health journey.
Yeah, it's so powerful, and it's so wonderful to hear that you haven't left nursing in order to just become a health coach. You've been able to really draw the health coach practice deep into nursing, actually, and into ICU, which I would have thought, oh, what are you going to do in ICU as a health coach? It's incredible.
Yeah.
Really lovely to hear.
For me, it's exciting, and it gives me hope. When I walk into that role within the hospital, I see it's really frustrating and it's really hard, because I can see that the age is going down, the chronic illness. I see people younger than me who are really suffering and stuck. I look at part of my job is to kind of look at all of their health history and try and solve the problem of this deteriorating patient, get in early and prevent organ failure. And what I often see is, someone in their 30s, 40s who's in the hospital every month. They are attending multiple clinic appointments. It's almost like a career. And I'm looking at that going, this doesn't have to be.
Yeah.
And so that almost puts the fire under me to keep doing this work. I think what I've realized is there is massive hope in health, and it comes in the form of seeing people in a different way, using this lifestyle medicine and science where we actually can, try and get out of this ultra processed food environment. We all have choice.
So, Sonya, what stumbling blocks have you had, if you have had any, in bringing the health coach model into ICU? Has it been accepted by other people? Do they understand what you're doing, or has there been a bit of pushback?
Oh, look, what I would first say is that health coaching is something that doesn't have strong public awareness yet. And so it is definitely changing. It is very popular over in the UK and in the United States. But here we're still working hard to get public awareness. I know that in the primary healthcare sector, there's health coaches there. But I think that's probably one of the biggest things was actually being able to articulate what a health coach is. And there's that kind of, humans don't mean to, but we're all judges. And we love to label. And so, I'm often told when I'm in the hospital environment, oh, you won't eat that because you're one of those.
Mm.
And so, for me, that's tough at times. But for, health as well, right?
Mm.
We're seeing all around us the results of that food environment.
Mm.
So, it's fighting that kind of, I guess, attitude. And the challenge also of just getting out in the community and getting clients and getting people to understand that if, those simple things, if you take on that project management of your own health, you can actually find more joy, be healthier, have more energy, all of those things that I know
Mm-hmm.
Colin, so well.
Yeah,
So,
I think it's, yeah, totally. It's so fascinating, I think, the impact that we can have if we take a different model, a different view, and we really come in with this preventative, whole person, empowering approach to health and well-being.
yeah.
Yeah.
And I would say in the mental health arena, I like to call it mental fitness, because I think just like your strength and your physical, you know, um, you go to the gym, you go walking, you run, you've got to keep those muscles going. You have to do that with mental health as well. And I think it's not something that we've really taken on.
Mm.
If we look at post-COVID world, there's been so much change, yet we're doing the same thing.
Mm.
How do we adapt? How do we get more psychologically flexible in a very complex, hyper-connected world?
Mm.
It's about looking at different ways, experimenting for what works for each of us. All of us are different.
Mm.
As individuals, our health is different. The way we see the world is different.
Mm.
Yeah, so there's so many factors in here.
Mm. And I've just been reminded with you speaking about this is this interconnectedness of the body and the mind, and the health of the body reflects the health of the mind, and the health of the mind will reflect. It's so intertwined, and for years we've had this model that separated mental health, physical health, and it blows me away how we have even separate areas to treat one and not, and I'm like, but it's all connected. This person's got metabolic syndrome and they're inflamed, and of course they're going to be depressed, and look, they're vitamin D deficient. Oh, hello. It's incredible, isn't it, that we're not coming together, which actually will bring me to my next question, which is, what obstacles do you think we need to remove to see a well-being shift? It's a big question, I'm sorry. To see a well-being shift in our healthcare industry. So what obstacles do we need to remove to see a well-being shift in our healthcare industry?
I mean, the first one is mindset. I think that we need to give the power back to the person and empower them to project manage their own health. I think that's kind of happening anyway, because of the waiting lists, because of, the ED, trying to even get to see your GP, calling an ambulance. There's only a certain number and they're not coming. So it's about empowering people who actually project manage, to experiment with their health, to actually have courageous conversations about what it is they really want, and bring in that science, share the current science, the lifestyle medicine science. What is out there? What's happening? What are the options for them? I also believe our food environment, up to 80% of what we're eating in New Zealand is ultra processed. It's toxic to our cells. It causes inflammation, glycation, oxidation. It is insulin resistance is rife. And so being able to have some influence on that, the cost of food. We're seeing the queues out in South Auckland, where I'm from, for people trying to get into GPs. What are some of these simple fixes we can take?
Yeah.
People are not sleeping, they're not breathing well, they're not connecting with each other. So, there is, I feel like there's so much to do and so much we can.
I totally agree.
Yeah.
Do you think that the change will come from grassroots or from top down?
I think it'll come from grassroots. What I see in working in the PREKURE environment is that we have a lot of health professionals joining engineers, hairdressers, mums, people from all walks of life who want change. They know that health is wealth. Without that, you have nothing. And they want change. I think it's happening from the ground up. I also believe in my own sort of little trickle of trying to make this change is health professionals. I'm specifically working with health professionals because a lot of them are incredible people. All of them are incredible people, but they're not looking after their own health. They're not understanding the consequences of their chronic stress, of the food that they're having to keep going, the dopamine hits. And so it starts with us.
Oh, 100%. It certainly does start with us. I couldn't agree more with that. Yeah. What do you think the next steps might be? So if a health professional is listening to this, for example, a nurse, we'll say a nurse because we're both nurses, so let's talk to the nurses. What do you think is a step that they can take? They're curious, they want to know more, they want to start making changes in the way that they nurse perhaps, or the way that they communicate. What's the first step that they could take?
Get hold of you and I, Helen. Get hold of health coaches. And I'm going to put a plug in here for the Health Coach Australia and New Zealand Association, who are the governing body for health coaches, making sure that they are HCANSA accredited, or as a body for health coaches, so they'll have a certain level of training. That's really important. But getting hold of a health coach, getting health coaches to come and speak to you, come and speak to nurses, talk about what we're doing. Get really curious. When you're looking at things one way, think about what are the other possibilities. What a lot of healthcare professionals that I walk alongside are thinking is, oh, well, it's just going to be that my sleep's always going to be this way. And I'm eating this to keep going. It's the only way I can get through. We have less resource, but I've still got to have 100%. Even though I'm exhausted, I can't see my family. I can't see through. It's almost, and I've been doing a lot of work around understanding neurobiology, a learned helplessness. It's always going to be like this, and I need to keep this going.
Yeah. I
think just get in touch and start trying to look at things in a new way. Because it's difficult.
I had the vision of a merry-go-round or a Ferris wheel, and actually sometimes you need to just get off so that you can actually look at things differently, because there's so much talk about, oh, we need more staff, we need more doctors, we need more even psychologists. And I'm like, if we were working at the base, if we were focusing on preventative healthcare, we would not need more nurses, more GPs. We would have no waiting lists. I just think the change could be phenomenal.
Yeah.
If we moved our focus and our care. And I do think, there are many obstacles. There are many people that, what you don't know, you don't know. So, even trying to get that little bit of curiosity for people that have no idea about looking after their own health, and believe that it's just genetic and it's bad luck, or all these other things that we may have been taught to believe. Just stimulating that little bit of curiosity in people. It's like it's a big shift, but I think it's so possible. And New Zealand's a wonderful, innovative country, and it's small, and we've only got like 2 degrees of separation, maybe more. But we have the potential, I think, to make massive changes in our healthcare model.
Oh, I am fully on board, Helen. When are we starting? Because I feel we started, both of us, but I just feel that time is now. The time is now. You can't even get into the BP. You can't even get into the ED. You can't wait. And I'm also a great believer in the power of groups and doing it together, having an accountability buddy, having groups, shared medical appointments. If anyone knows the work of James Maskell, being able to actually get the support to make changes. It's hard to make nutritional changes, but it can be done. It's hard to get up and move and do that strength if you're working in that merry-go-round. So thinking about doing simple things, but how are you going to sustain these habits long term?
Yeah.
Connection is medicine. Connecting with others.
Yeah.
So, yeah.
Yeah, and I think also actually having a whānau-based approach, because, if you're just talking to one member of the family and they're trying to do it on their own, it is very hard. This is where we need people to come into the homes and into the community. Right, what can we do? What do you know? And the thing I always find fascinating is that everybody knows what they're supposed to do. If you ask anybody, they'll say, I'm supposed to eat more fruit and vegetables and I'm supposed to move more. There is very few people that would say, I have no idea. But it's about how do we make that shift and those practical small steps that we can take in the right direction.
Yeah, the habit change techniques are really, really important in terms of that health coaching. And also what I've found is, just being able to articulate simple science and actually demonstrate, like encouraging people to experiment, trying different things, because I said it before, N=1, we're all different.
Totally.
And, that one size fits all of healthcare, I think, again, is something that needs to be shifted. And the fact that everyone is different, what matters to them, their life world is different. So being able to work with that and help them uncover their own vision, their own strategy, their own, what are you prepared to try?
Yeah. Yeah.
You don't have to do everything all at once. Small little habit changes over the course of time is the way to go.
I love that idea of N=1 too, because, I don't think we need another double-blind, randomized control, placebo-controlled trial to know that junk food or that, whatever it might be, it's like, oh, we need more studies. No, we don't. We don't need any more studies. These things are common sense. And as you say, let's get curious. Let's try this. How do I feel? How do I feel if I throw in an extra few vegetables on my plate? And after 2 weeks, how do I feel? It's just, it's a wonderful way to work.
I was just thinking also, because a lot of what we do as humans, I was talking before, it's survival. We spend a lot of time in the future thinking, what if, and the past, oh, I should have done this and that. And so we seek these dopamine hits to feel better through food and watching, an omnibus of Netflix and all the like. And so working alongside people and groups to understand, well, what actually gives you joy? Where can you get that joy other than these things that are actually causing your insulin resistance, your diabetes? What actually getting to know themselves and what's important to them.
Yeah, totally. Such a good exercise, isn't it?
It is.
Yeah. Name 10 things that give you joy. It's one of my favorite little exercises to get people to do.
And people often have to go away, don't they? Because they're like,
Yeah.
that.
Yeah. And what I always find amazing is it are such simple things. It'll be watching the sunrise or noticing a flower or playing with my nieces. Like, it is simple things, or spending time with my dog, and you're like, they're there for you. You know, how about we make these a priority in your life? Yeah. I'm going to ask you a coaching question, Sonya.
Please do.
What are you most proud of?
What am I most proud of? Wow, that's such a good question. I'm going to have a little think about that one. So many things. I'm proud of every person that I train as a health coach faculty member for PREKURE, because they're courageous. They come out of wherever they're working, whatever they're doing, and take the risk to do health in a different way, to kind of take on something that's not the norm yet, and actually be prepared to be doing things in a different way, and to me, in a more meaningful way. So I'm proud of them. I'm proud of the journey I've had, kind of transitioning as an RN and years of the institution, secondary care, and being brave enough to come out of that and try something new in my older years. And also for, despite sometimes feeling quite a lot of struggle and, getting a few brick walls, keep going. Because I know this from my clients, from the groups that I work, that this does make a difference. It really does. And so I'm really proud of holding on to that hope.
Yeah.
The future is bright.
It's wonderful because as you were talking about the people that you're training, my immediate thought was, and the people that they're going to be talking to, and then the people that that you tell two friends, they'll tell two friends, and so on and so on and so on. The ripple effect of this is this is what I think, as you say, grassroots, ripple effect, person by person will make the change.
I've been very lucky through PREKURE to train quite a few cohorts now of Pacifica health coaches and Te Ao Māori health coaches, and I'm very proud of that in the way that instead of delivering courses that kind of you must, this is the way you'll do it, we are delivering, here's some tools, ideas, now show us how you'll do it in your way.
Very cool.
And when I'm seeing them get in touch with their own intuition, their own ancestral knowledge, kaimoana, spirituality, the wairoa, all of that, you can see these light bulb moments, the aha moments. And for me, that is just amazing.
I discussed this a little bit with Dr. Devon Tan, who's a child psychiatrist, is actually giving the health professionals permission to actually step outside the square a little bit. I don't know about you, but I always felt that there were these very tight boundaries that you were not allowed to step outside. But if you give a health professional a little bit more scope to move with, how might you do it differently? Where is your strength, and how would you move? How can you bring that into your practice? And I can see that with different cultures, because they will have completely different strengths that we won't know about,
Exactly.
completely different ways of delivering care. And how powerful is that to have them bring this into the medical model? Yeah.
Oh, it's just so good to see. For me, it's the mindset of not instead of, as well as. And kind of just giving more homage to creativity and equity of thought, and actually just, again, that experimenting.
Mm.
What are the possibilities here? How can we use this in a way that serves us and our community?
Yeah.
So, yeah, that's exciting.
Yeah, that is very
and there's
cool.
a lot of work in reversing diabetes, getting people into remission in diabetes. That is going on in the communities in Northland, down south, here in Auckland, which is really exciting work. So I'm very happy to be part of some of that.
Such a game changer, and how many lives will be saved,
Okay.
let alone hospital hours and costs and all those other things that we measure. But yeah,
Totally.
saving lives. I think we've covered just about everything, because the other thing was about hope for the future, but I think you've really covered that in the talk. Is there anything else you'd like to say, Sonya?
No, I think, thank you for having me, Helen. It's been a great conversation. I think, despite the struggles in health, despite all the media and everything that we hear every day, it is important to, take that perspective, and with health particularly, that we do have choice.
Mm.
There's always choice. And on an individual level, on a community level, take it and run with it.
Mm.
And be open to the possibilities. Science is changing every day. We need to change with it.
Yeah.
And get curious. Like you said, like I said, getting curious is the key.
Fantastic. Thank you so much for your time and your wisdom, your knowledge. It's incredible, and I love the work that you're doing. And this is changing lives, and incredible.
Thank you.